Welcome to November 2011 Health and Information. I'm Dr. James Bissland. I'd like to welcome all of you to our program this month. And as you can probably see by looking around here as our camera zooms around the area, we're not in our normal studio at this time. We're coming to you today from Sonoma, California, up in the Napa Valley area. And you know, I was going to say that we're going to have a program that's a little different this month, but I think I've been saying that every month. So maybe we're not going to have a normal with our program, at least for a while. But this program is going to be a little unique this month because we're going to be focusing on Chiropractic Miracles. And one of the things that we're going to be looking at is what happens in an office that maybe the public doesn't know about. The kind of conditions that respond to chiropractic care, but don't necessarily make it to either news or don't necessarily make it to where people have a general understanding of that. Also, a little different this month is going to be that the miracles and the things that we're talking about are going to be told to us by the doctors that actually did them. And we've got several of our colleagues here that we're having a meeting in San Francisco, and they are going to come on with us throughout this program and tell us about some of the things that have happened in their offices that are unique, that they would consider to be their chiropractic miracle. So I'm going to start off here in Sonoma and tell you a little bit about the biggest one that I had, and this happened when I actually practiced in Florida. We had a gentleman whose wife called on the phone one morning, and she said, you know, my husband is just absolutely horrible, can't move, and he's stuck in his truck. And I said to her, take him to the hospital, because he couldn't move his legs, couldn't move anything. She said, he won't go. She said, he told me he's either going to come see you or just stay in the truck until he can get out. So I said, all right, go ahead and bring him in. And she brought him in, drove into the parking lot, and we pulled a stretcher out of the storage that we had put in there. And we took the stretcher out to the parking lot of the office, and we lowered it down to the level of it, and between my father and I, we took him and got him out of his truck onto the stretcher, wheeled it into the clinic, and began doing some muscle therapy just to get him relaxed to the point where we could stand him up and do the x-rays. And that's kind of an important thing. We did finally x-ray him, and after about 3, maybe 4 months of treatment, he was back to being 100%. And the interesting thing is this guy was a plumber, so he was having to bend all the time. We found out that when we did the evaluation that he had a slip disc, and so we provided the appropriate treatment for it and got the disc resolved, got the condition resolved. And last I heard, which has been several years now, there's been no recurrence of the condition. So I would say that's probably my miracle among probably many that have happened over the more than 26 years that I've been in practice. But we are going to be talking a lot more about miracles in addictions, and we're going to talk about miracles in internal organ conditions, and might have a few more surprises in there. So stay with us. And we're going to be having a lot of our colleagues come by and tell us about more miracles in the chiropractic office. Now, some of you who come into our office realize that we do treatment for addictions and compulsive disorders. And we've had some great results in that over the years with the treatment protocols. And I have a colleague here that I'm going to introduce to you, and she's going to tell you a little bit of a story about a patient she has. So welcome, Dr. Kathy Cook. Thank you for joining us.
Thank you for having me.
Now, Dr. Cook is a chiropractor from Bay City, Texas, correct?
Correct.
Okay. Kathy, would you tell us a little bit about your miracle with the addiction?
Yes, we've implemented a new service in our office. It's new to us. It's auriculotherapy. It's non-needle Chinese medicine. And we have started addiction programs. And one of my patients came to me because she smoked over 2 packs of cigarettes a day and has done so for over 20 years. Well, she had a great incentive to quit smoking because she had a new grandson, and her son would not let her hold the baby because she smelled like tobacco and smoke. So she had a great incentive to quit smoking, but could not quit smoking on her own. So we implemented the auriculotherapy for addiction with her, and she is smoke-free today. So we're very pleased about that.
Oh, she's been smoking 2 packs of cigarettes a day for 20 years. And how long did it take you to get her where she's now not smoking any?
It took less than 3 months. She also worked in an environment. She drove a forklift. So the employees had a routine. On breaks, they would drink coffee and go outside and smoke cigarettes. So there was a routine that she had to work around, and her coworkers, and put up with a lot of peer pressure, but just done real well with it.
Fantastic. Okay, would you consider that to be a big miracle in your office?
Yes, I would.
Thank you very much. Appreciate it.
Thank you.
Okay, we're looking about miracles in chiropractic clinics here on this month's program. And you know, we were talking just a minute ago with Dr. Cook about the addiction and compulsive disorders, and we're going to do a whole other program on that probably in January or February. But you know, one of the things that we've seen a great deal of results with chiropractic care is internal organ conditions. Now, if you'll remember last month, I had mentioned that if you have an internal organ problem, you have a nerve problem. And a lot of times as we go and improve the nerve function to a particular organ or cell, it's going to improve that function. So in continuing with our theme of miracles in chiropractic clinics, I'd like to introduce our friend Dr. Jim Silva. He's a chiropractor from San Antonio, Texas. And Dr. Silva, you were telling me just a few minutes ago about a case that you had a lady who had a problem with her ovaries. Would you like to tell that story?
Sure. We have this woman that I had as a patient who couldn't get pregnant. She and her husband had been married for approximately 16 years. And the only different thing that she did in her life was come see us at Silva Chiropractic. They're in San Antonio, Texas. And inside of 5 months, voila, the 2 cysts that she had on her left ovary had just dissipated, just disappeared. Well, she went back to her gynecologist and OBGYN, who was so excited to let her know, oh, and by the way, you're also pregnant. So that's one of our stories that we like to express and tell. And that was just a matter of a few months ago.
Now, what do you attribute that change? I mean, obviously she'd had so long and so many years that she couldn't get pregnant. There was only one thing she changed, is that correct?
That's the only thing that she changed, was coming to see us and having subluxation in her spine. After her subluxation changed and cleared, and she started getting normal curves in her neck and her low back and her spine, she miraculously disappeared, or miraculously the cysts disappeared, and she got pregnant.
Where did you find the major subluxation in her spine?
Well, she had several subluxation, primarily in her neck and in her low back.
Okay. So as you see, there's miracles going on in chiropractic clinics all over the country. We're going to have more of our colleagues joining us over the rest of the program. Hey, we're continuing our theme of miracles of the chiropractic office here in Northern California, and we're in San Francisco today for this part of the program. You know, one of the things that we often see miracles in is children, and of course we know that children are the future of our economic and our well-being and of society in general. And so I was talking with a colleague, Dr. Darcy Stotts, and she has a little interesting story about a miracle that happened in her office with children. So I'd like to introduce you to Dr. Darcy Stotts from San Angelo, Texas. Thank you for being here.
Thank you. Thanks for having me.
Now, you were telling me you had this patient, a child in your office, that you would consider that pretty much a miracle.
Yes, I would.
And do I understand that it even got written in the newspaper?
Yes, it did.
Okay. Well, why don't you take the microphone here and tell everybody about your story?
Thank you, Dr. Jim. This story is a really important story for my staff and my clinic family, and really anybody to share about chiropractic. We met a young little guy. He was a 4-day-old newborn by the time we saw him. He was referred to us from his grandmother. He had been born on a Monday. Everything looked great, but that afternoon he wasn't really nursing, and the doctor said, though, he'd figure it out. Next day he wasn't nursing, and that was still pretty early, so the hospital didn't worry about it too much. By Thursday, the family was very distraught, and the mother was completely a wreck over the whole thing, and he had not eaten anything. He had an eyedropper that they were using to feed him milk with, but he had not learned to latch on and nurse. The hospital said that that was very normal, even though he had lost over a pound, and he was only about 6 pounds when he was born, so he's pretty tiny. And the grandmother referred young Kiernan to our office. Kiernan was brought in, of course. By this time he was completely lethargic, past the crying point, didn't cry, didn't wiggle, didn't move. And we were pretty concerned. We took a full spinal exam and checked his upper cervical spine and found that his atlas was misaligned. And that was impinging nerves at the brainstem, at the jaw joint, facial nerves, the hypoglossal nerve, cranial nerves to his face and to his mouth and his tongue and his hard palate and soft palate. And we found that after we provided a very soft chiropractic adjustment with an instrument, computer-assisted instrument, Kiernan was able to start moving his face and his lips, and he latched on about 2 hours later to nurse. And within about 24 hours, he'd gained about 11 ounces. And so that was an amazing thing. So we checked him Friday, and then we checked him again on Saturday. He needed another adjustment. And what became a very crucial point in his life actually turned around his entire health, and he became one of our favorite patients, and he got adjusted every week after that. And he needed that for about another 4 or 6 weeks. And now Kiernan today is a happy 3-year-old normal kiddo, runs and plays, and he's super healthy, fortunately, because of chiropractic.
Great. And how long overall did his treatment take to get to the point where he is now from where he started?
We adjusted him about 12 times.
12 times. Fantastic. Darcy, thank you. Appreciate the story.
Thank you for having me.
Okay. Now, our next story talks about a miracle that happened with a chiropractic patient. This particular patient had something called torticollis or wry neck, and I'd like to introduce you to our colleague, Dr. Rita Goldman from Maysville, Kentucky. And Dr. Rita is the one who saw this miracle happen in her office. And Rita, thanks for joining us.
Well, I'm delighted to be here with you all today. This patient came to me recently, and she had for 2.5 years her neck turned to the right so badly that she had to hold it up. So she would go around all day like this. She couldn't sleep normally in a bed. As a matter of fact, she couldn't even get more than about 2 hours sleep at a time at the most. And she had been to every kind of doctor imaginable. Nobody knew really what to do with her. She'd been put on every kind of muscle relaxers, and she'd even been told that this was a problem that wasn't physical, it was a mental problem that she had. So she didn't know where to go. She was referred into our office and came in really about 3 or 4 months after she'd been referred because she had so much apprehension. She'd been to other chiropractors, and the other chiropractors wouldn't even touch her. When she came into us, we really knew exactly what to do with her. In our office, we have been blessed to help many unusual cases, and I'd had several cases like this. I'd had a little girl in 2 weeks before that was only 7 years old, and she had just responded beautifully. So we started the same treatment with this lovely lady, and now after 5 visits, she can turn her head back to the left, all right, and can hold it forward, and she's no longer having to support it. It isn't to the center line all the time, but there is such a drastic improvement that she looks like a different person. So this has been a wonderful miracle in her life. She comes in and she has cried with me. She's been so overjoyed with her results. So if you have someone that's got wry neck or a spasmodic torticollis, that's what this was really diagnosed as, send them to a chiropractor.
Thank you, Rita. Now, this program is, you all know, is a internet-based, so we don't know where everybody's going to see it. But we understand that you and your husband, Dr. Arnold Goldman, have a radio show.
Yes, we do.
And when is it on?
We're on Wednesday mornings from 10 to 10:30 on 99.5 out of Georgetown, Ohio. It's WAOL.
Okay. So maybe they have a website that has an audio feed and people can listen to you worldwide.
Tune in to us because we really have a great time, and the program is called With the Goldmans.
And you do let Arnold talk, right?
Not very much.
No. That's what I thought.
David's on with me now, my son, okay? And he's taking over. It's more like, does he let me talk?
I can't believe that one. Rita, thank you for being here. Appreciate
It's been a pleasure.
Okay, we're going to continue on here with our theme of chiropractic miracles. And you know, we see things every day in the office that just amaze us, and we don't talk about them often enough. One of the things that we've seen, and I've seen in my practice as well, is people who are really bad. They can't walk. They're in a wheelchair or whatever. And there's a story here that is pretty interesting. I'd like to introduce to you our colleague, Dr. Randy Fick from Cincinnati, Ohio. Randy, thank you for coming.
Thank you.
Tell us the story.
Okay, well, we treat a lot of difficult cases, and this is a case where a lady came in our office who was in a wheelchair. She could actually stand, but only for a brief moment in order to transfer herself from the wheelchair to a table. She actually could not walk at all. The lady had a chronic lower back condition. She also had stenosis and quite a bit of scar tissue from 2 back surgeries. So over a period of time, the scar tissue has led to a mechanical dysfunction as well as neurological dysfunction. So her inability to walk and her inability to ambulate came from neurological weakness in her legs, but also mechanical weakness in the fact that the lower back could not get itself into a proper position to ambulate. So what we did is we realized that the stenosis and the scar tissue was really bad, and we started her on a treatment of shockwave, which is a type of therapy similar to ultrasound. However, it's about 8 times stronger. So we ran that along her rector spinae, and over a period of about 4 weeks, she began to use a walker. We continue to do chiropractic treatment on her in order to get the stenosis and the motion in the lower back going. And after about 4 weeks, she started using a cane. And the more chiropractic and the more shockwave we did, the better she began to move, and the more her legs have become useful to her. After about 8 weeks, she got rid of her cane, and then she has been walking without a cane and without a walker. And you certainly can feel the lower back and feel that the scar tissue is much more flexible. You can feel that the back is more functional. Now she does continue to get supportive chiropractic care, but in her own words, I only have to come in about once every 8 weeks in order to prevent myself from deteriorating back toward the wheelchair. So about 6 visits a year keeps her out of the wheelchair, and she certainly is much happier and healthier, and is doing quite a few things now. So that's my chiropractic miracle. We do see miracles every day in the office.
Absolutely. And you know, the one thing and the reason we're doing this program is we don't talk about them enough.
That's correct. But miracles are happening every day.
Every day. Randy, thank you very much. Okay, we're going to continue our talking about miracles in the chiropractic offices. And you know, one of the most debilitating things that people can get is sciatica, which is the hot shooting burning pain that goes from your low back down through the pelvis and into your leg. And I have a colleague here who's got a really fantastic story about sciatica. Would you all welcome from Arlington, Texas, Dr. Joe Virno. Hello, Joe.
Hello, James. How are you today?
Good. Tell us a story about your sciatica.
All right, I'm glad to. I've treated thousands of men and women that have had sciatica, and as James just explained, it's a sharp lower back pain that will extend, radiate down through one buttocks area and down the back of the leg and all the way to the foot. The patient I'm thinking about is Ray. And Ray had lower back pain for many years, and he elected to have surgery, and he had a laminectomy done on his lower back, and it seemed to help him, and he's a golfer, and however, the lower back and leg pain returned even though he had the surgery. It's been my experience that over half the time, surgeries initially will give you good symptomatic relief, but with the passage of time, the symptoms do return. So Ray's a golfer, and he's also a widow, and one of his big things is playing golf, as I said earlier, and he wanted to get back on the golf course and enjoy his retirement. Ray is a financial type consultant. He's retired, but they still retain him because he has so much knowledge and can still help the company, and he sits on the board with the monthly board meetings to help the company continue its success. So on examination, if I would raise up his right leg, you should be able to raise it all the way up with the sole of the shoe pointing toward the ceiling of the room. Well, in Ray's case, we could only pull his right leg up approximately 30 to 40 degrees. Normal is 50 degrees. And he had really a hot lower back. When I would palpate it, it'd be very, very tender. And we did the test called Valsalva, and which determined that his disc in his lower back again was flaring up. So as a result, and he also had a short leg and a restricted range of motion, and he had many sleepless nights waking up in pain when he would roll over in bed. So upon examination, I realized he was having severe pain and was very unstable in his lower back structure. So we walked him across the hall, and we took a couple x-rays of his back, one from the front, one from the side, and we could see where he had had his surgery, and we could also see where he was having the disc wedging. Normally the disc should be flat, we'll say like a donut, but his case, he had disc wedging, which is similar to like a doorstop for a door. So after analyzing the x-rays for an hour and having him sitting with therapy for a while, we then had him come back, and after I'm a Gonstead chiropractor, so I analyzed the x-rays using the Gonstead methodology, which I've had great success with that system, and I determined he needed to be adjusted. And Ray underwent a treatment protocol of approximately 20 treatments. He did not want to have any further surgery, because after you go through a surgery, you really don't want another surgery, because there's a lot of things that will come up and then you realize it was unsuccessful, and he did not want surgery. So we proceeded to adjust him side posture, where we have him laying his side, and I contacted his L5 spinous and adjusted him using the Gonstead technique. And after the first adjustment, he felt some relief. We also used decompression. I have the DRX 9000 decompression table, which is the #1 table in the world, and that reduced the size of his swollen disc, and it rehydrated it, made it taller, opened up the nerve hole, and we also used a couple more therapies to decrease pain and swelling. And as a result of that, after going through about 20 treatments, he was totally pain-free, and he's been back playing golf now for couple years at least, and he's very, very happy and very sold on chiropractic. So happy he's written me testimonials that I've been able to use for other patients to read, and also he puts them on the internet for me. Thank you, James, for having me here today, and hope this helps you out some.
Well, thank you. Appreciate it. Okay, we're continuing on with our Chiropractic Miracles stories today here from San Francisco, California. One of the most debilitating things that a patient comes to see a chiropractor for is migraine headaches, and we have a colleague here who has a really good migraine headache story that was a miracle in his office. Welcome, Dr. Bruce Weiland from Whittier, California. Doc, thank you.
Thanks for letting me come and share this.
Tell us your story.
Okay, so Dr. Bissland asked me to talk about this particular miracle, but I want to take a step back. Next year I start my 33rd year in chiropractic practice in January. I am a chiropractor today because as a pre-dental student at Cal Poly in San Luis Obispo, after getting out of the military, I began to have hand problems and almost could not use my hands anymore. If it wasn't for chiropractic, I wouldn't be here today. So that's why I'm a chiropractor. We see miracles on a daily basis, and it's almost impossible to remember all of them. But just as an example, I had a woman who came to me. She had a 25-year history of migraine headaches. She'd gotten so bad that they were now hospitalizing her every year and putting her in a coma, a medically induced coma, for a week to 2 weeks. And that had been going on for several years now. She was on the last medication they thought they could put her on. The concern was because of the control of the migraines, they kept having to raise the level of medication, and the toxic effects could kill her. So she came to me hoping to get off of this care. Now this was back in the late 80s. She had no insurance. She had to pay out of her pocket. I saw her about 180 visits in just under 2 years. But after the first 100 visits, she was off all medication. At 180, she was having no headaches. Not no migraines, no headaches. 3 years later in follow-up, she still had not had a single headache. The question is, how many visits would it have taken if I'd seen her 25 years earlier? Now, can we help all migraines? Only if they're being caused by something that we work with. You've got a tumor in your brain? Obviously not. That's why we do exams. That's why we do x-rays, so we know that what you have is something that's likely to respond to what we do. So if you've been suffering with migraines and have not been able to get assistance, you need to get yourself to a really good chiropractor. Thanks for listening.
Okay, thank you. Appreciate it, Bruce. Okay, we're going to keep rolling here. We have a really interesting story. Now we're going to deviate from our theme a little bit here in this last segment, but we have a lady that I've known since I was 10 years old, and she has an interesting story about Bell's palsy. So I'd like to introduce Miss Isla Kelton. Now, Isla, you had a trauma, and I'm going to let you just kind of tell the story from the beginning here, because I've heard about this story since I was 10, but I didn't necessarily remember all the details. So tell us a little bit about what happened and the symptoms and what course you've taken to get it to where it is today.
Thank you. Yes, when I was 16, my horse and I were jumping fences, and we both landed on our heads. And that resulted in a spinal injury. And after that, I had horrible migraine headaches. And then a few years later, I was married, working an accounting position in a big company, had a husband and a small son, and I got Bell's palsy. The left side of my face became completely paralyzed. And I'm sure you've seen people with Bell's palsy. You might not have recognized what it was, but your eye droops, your mouth droops, you drool. It's really horrible. And I was suffering from it for about a year and had gone through a number of types of doctors and treatments, and nothing was helping. And a neighbor of mine suggested that I go with her to her chiropractor. So I did, and after examination and x-rays, he said, well, you've had a spine to your you've had an injury to your spine. And I said, yes, I did, but no one else had ever connected that injury to my facial paralysis. And he said, well, I don't know if we can help you, but I'm willing to try, but I can tell you it's not going to be easy and it's not going to be of short duration. And I said, you know, I can't live, I don't want to live with this kind of facial paralysis the rest of my life. I'm willing to do whatever it takes to improve. So I started going to him every evening, 5 evenings a week after work. And this went on for about 3 months. And I was getting very disappointed in it. And he said, I think we're making progress. And we did. We did. I could begin to feel a change in my facial expression and the way I was feeling. And so we moved it up to three times a week. And I went for another 6 months, and it was becoming much better. And so then we finally got to where I was going once a week. And I continued to do that for 3 or 4 years. In fact, finally, the doctor said, well, you're coming here so often, why don't you just go to work for me, and then you won't have to spend all your paycheck on treatments. And I did. And so I have had chiropractic care for some close to 50 years. And I have had thousands of treatments, but I have not had one too many. And I know that chiropractic has kept me healthy. I will soon be 83 years old, and I've never been in a hospital except when I had my son. And I take no medications, and I'm really, really healthy, and I thank chiropractic for it every day.
Thank you. Do you still continue to get treated regularly? Is that correct?
Oh, I do, yes.
How long can you go without an adjustment before you start seeing a change to your Bell's palsy?
Well, it depends on what I'm doing, but one of the things that is very strenuous for me is riding in a car for any length of time, say an hour or more. So I know if I'm doing physical activity or I'm riding in a car, or there are a few other things that I can begin to feel the muscles in my face sag, and I know I need to get back to the chiropractor. And it's never more than a couple of weeks between treatments. And lots of times I'm in the office 2 or 3 times a week.
And one of the reasons that I asked Isla to talk about this case is because of the chronicity and the significant injury that she sustained. And there are a lot of times we see patients in that situation all the time, but I would consider your story to be a miracle.
So would I. Thank you.
Thank you, Isla. Okay, well, we've seen a lot and heard a lot about miracles here in the last about half hour or so. And I want to thank all of our doctors for participating in the program tonight. And we've really had a good time out here in San Francisco. And I'm going to have Thomas kind of scan over here. We're about a little over 1.25 miles away from the city of San Francisco. We are on Alcatraz Island. And if you look behind, in front of me, behind the camera here, and look up there, this is a pretty interesting sight here from Alcatraz Island. You know, as I think more and more about some of the stories we heard today and think about the miracles that we see every day in our offices, we need to be talking more about them. We need to be thinking more about them, and we need to be appreciating the fact that all of these doctors that you've seen in this program are all helping to improve the lives and the health of all their patients. Now, for contact information for each of the doctors, we're going to put their names and addresses and phone numbers up on the closing credits here of the program this month. And I want to thank everybody for watching the program. I want to thank our participants, and hope that you got something, information that you can use and something that would be beneficial to you. So I'll see you next month on Health and Information. Until then, have a happy, healthy, and safe month.